It's no secret hospital personnel are stretched thin during this pandemic. Our Ayanna Willoughby spoke with a nurse at Crestwood Medical Center to see how she's holding up.
You don't want anybody to ever have to live through what we're living through or to see what we are seeing, but if you just caught a glimpse.
She's worked at Crestwood for 7 years, and her eyes have seen things that we can't even begin to imagine.
I get up very early every morning. The very first thing I do before I even get out of bed is I check and see how many patients we have in the hospital.
Kris Goodwin is the Chief Nursing Officer at Crestwood Medical Center. Her job is to oversee the nurses who are caring for your friends and family.
I see my job primarily as taking care of my staff, taking care of the nurses.
She took the job in the middle of the pandemic, and she's trying to make the best of it.
And in June of this year, I became the Chief Nursing Officer.
Kris has a family of her own at home, but once she steps into the hospital, the nurses and staff become her main priority.
So it is difficult leaving my family to take care of my other family, but they all mean very much to me.
She knows what the patients go through, and she's seen how the pandemic has impacted her nurses.
I also have people that this has just been a lot. It's very emotional, and they're coming in and day out and giving everything that they have to take care of our community.
Despite the exhaustion they're feeling from the overwhelming amount of sick patients, they're persevering, and our community benefits from their hard work.
But the work that that the staff has put in for this patient population is incredible.
They work around the clock, monitoring COVID numbers, taking care of sick patients, and keeping the hospital afloat.
We pretty much, from the minute we hit the ground, we're running, and then even when we leave here, our work doesn't stop.
At Crestwood Medical Center, Ayanna Willoughby, Fox 54.